Hello, thank you for taking the time to watch our presentation on eating disorders and therapeutic use of the arts as treatment. My name is Belle, and the other ladies who worked on this presentation are Lexi, Jenny, and Emma. I'm going to start this presentation by giving some background information on our topic. Eating disorders come in many different forms. They don't discriminate based on gender, race, or social standing. Almost 30 million people in the United States alone suffer from this disorder. The definition of an eating disorder is any range of psychological disorders characterized by abnormal or disturbed eating habits. There are a few forms of eating disorders that are most common. These include anorexia, bulimia, and binge eating disorder. Anorexia is an emotional disorder characterized by an obsessive desire to lose weight by refusing to eat. Bulimia is a disorder involving distortion of body image and an obsessive desire to lose weight, in which bouts of extreme overeating are followed by depression and self-induced vomiting, purging, or fasting. And binge eating is the consumption of large quantities of food in a short period of time. These three are the most common, collectively making up approximately 60% of all eating disorders. Recreational therapy is recreation and other activity-based interventions used to address the assessed needs of individuals with illnesses and or disabling conditions, such as eating disorders, as a means to psychological and physical health, recovery, and well-being. The interventions that we chose to focus on are the therapeutic use of the arts. The expressive art therapy is an approach that utilizes a variety of methods, including writing, visual arts, drama, and dance to help people achieve personal growth. Self-expression is a key component of expressive art therapy. Something incredibly important to note about our research is that there is a huge difference between art therapy and the therapeutic use of the arts. They are not the same thing. An art therapist is someone who's specifically certified to use art as therapy. They are taught and trained on how to decipher and understand meanings behind the art that people create during their therapy sessions. CTRs simply use art as a means to heal and as an intervention. Recreational therapy can be used to help treat the symptoms of an eating disorder. Now, Jenny will discuss the importance of our research as well as the heavy impact that eating disorders have on society.
All right. Thank you very much for that introduction and for defining what eating disorders are, so we have a basis on what we're going to be talking about today. So I wanted to pull a few statistics that just kind of show why it's so important that research is done on this topic and that we work towards finding effective treatments in order to help this population of people that are struggling with eating disorders. I also wanted to kind of touch on just how prevalent eating disorders are in our world and our society, and just how many lives it impacts, because I think we hear about them a lot, but I don't think we know just how many people struggle with eating disorders. So eating disorders impact at least 9% of the population worldwide. One of the scary things about this statistic is it is at least 9% of the population, meaning it could be even higher, whether that's 10, 11, 12%. There's many people that probably don't get the help that they need, which is really unfortunate. But it's at least 9% of the population worldwide. To put that in a numbers perspective, that's 28.8 million people in the United States alone that are struggling with some form of eating disorder, whether that be anorexia or binge eating disorder or bulimia or any other eating disorder that they are struggling with. Some other statistics that are really just show how prevalent these disorders are and how important it is that we help find effective treatments is one person dies every 52 minutes as a direct cause of eating disorders. So whether that be from malnutrition, or as this last statistic touches on, 26% of people with eating disorders attempt suicide. So 52 minutes, someone is dying from some some issues with eating disorders, and that's far too often, and treatments definitely need to be found. It is the second leading cause of death related to mental health, the first being the opiate epidemic. And it's just, I think sometimes eating disorders and the treatments of them can be often overlooked, but when it's taking so many lives and affecting society in such a substantial way, it's something that we really, really need to talk about. So that is kind of what we are doing in this PowerPoint. Okay, to continue why this is important, we decided to do our research on the use of like the therapeutic use of art in the treatment of eating disorders and how it helps and why it's important. So we found throughout our research that art helps decrease many of the negative symptoms associated with eating disorders. It provides first and foremost a nonverbal communication method between the clients and maybe their therapist or just the outside world. They're able to express themselves in a way that's different than they're used to, because many times it's hard to put things into words just for anybody, and especially when you're dealing with something so significant, it can be really hard to express yourself with words. So art, whether that's dance as we touched on, or painting, or just drawing or writing, it can be a different way for them to express themselves that's not simply talking. A commonality we found between many of the articles we researched is it creates this increase in like self-awareness, which is huge in the treatment of eating disorders. That's one of the like key goals that people try to reach. So that was a super important thing that we were able to tie back to art. Next, we want to talk about how there's just kind of a lack of research in related to like expressive art therapy. A lot of that is based on the fact that it's used with other types of therapy, so it's hard to like find a direct cause related to that. But I think it's really important that we continue doing research on the different methods in treating eating disorders and what is effective and what is not. So I also want to touch on this study by Frisch, Franco, and Herzog, who in 2006 did a study on 22 inpatient residential eating disorder facilities that were doing some form of art-based therapy at least once a week. It was really cool because we were able to see the like success rates and like how people reported the effects that these art-based therapies had. And a super common commonality between all of these is they said that it aided in self-discovery, self-exploration, self-expression, and increased coping mechanisms, which, as we know, are all super, super important in treating eating disorders, especially coping mechanisms, so that when people are feeling certain urges and feeling like they don't have control, they can use their preferred art-based therapy method as a treatment.
When we went about our research, conducting our research for our paper, there was a variety of different ways that we went about doing this. So how we first started out some basic research is we came up with a research question, which was art-based therapies and how they work with eating disorders and the benefits they have on them. And some of the keywords that we used were eating disorders. We wanted to know the risk factors. We also wanted to know the benefits of each intervention with a specific group. We also wanted to know the control of the body, wanted to know how we can control our body and our mind when it comes to having an eating disorder. We also looked up art in general, just wanted to know what impact being creative and engaging in art had on this specific population. Some of the databases that we used were PubMed, Google Scholars, we had Science Direct, and then one really helpful database that we ended up using was Ulrich. And what this is a database that you can put in certain articles and it will tell you information about when it was published and whether or not it was peer-reviewed. So in this case, we wanted to make sure that we were using peer-reviewed articles, so that way it's having lots of revisions and most of the data that's in it is proven by the specific stats that they were finding. And overall, when we were conducting this research, we wanted to narrow down each article and find exactly what we needed. So that's where the key words came into play. And that's where we were just researching specific things we wanted to find. And then you could put advances. And we also wanted our articles to be from the year 2000 to 2022. There are a few articles that we did end up using that are a little bit older than that, but overall had good content in them. So going into the literature review, we looked at a bunch of different articles and we used a bunch of different interventions as well to figure out what the benefits were for each one. So the first one that I'm going to hit on is music and how that plays a role in the treatment of eating disorders. So what studies found based on our literature review is that it allows people to relate to songs, and overall that creates an awareness within each individual. And this overall helped with the self-discovery. By listening to certain lyrics, there can be certain things that trigger you to respond in a certain way. So what I mean by this is, say if I'm listening to a song, there might be one part of the lyrics, the song lyrics, that stick out to me and can help me either express how I'm feeling. Like, patients can pick out certain things that are going on in their life, like I can relate to this, or this is what I want for myself in the future. So that's how music therapy overall plays a role in benefiting these individuals. Another thing that we found in our literature review is that music also helps as a healthy coping mechanism, which means that it helps for individuals to be able to relax. So by listening to some music, individuals can close their eyes and just listen to what the songs are saying, and they can also connect with one another while they're engaging in this group. So how that works is they can talk about each song and how these lyrics play a role in their treatment or how they are feeling. So that overall is a really good feeling for these individuals because it shows that they're not alone in their treatment and the ways that they're feeling. It also gives a nonverbal aspect to the type of treatment because they're not having to flat out tell people how they are feeling, and they can pick out specific lyrics that apply to their life and apply to what they're going through. Like I said before, just the overall process of knowing you're not alone during this time is a really big thing for this individual group, just because they're going through a lot mentally and physically, and we want to try to eliminate all those emotions that they're feeling, the negative emotions, and bring out positive emotions. And that's where self-awareness really comes into play. And a lot of these modalities that we researched in our paper have a lot to do with self-awareness. So that's where we really want these individuals to be able to have self-discovery and really be able to process what's going on a deeper level without having to stress these individuals out and have them say, I feel like this, and have other people maybe judge them. There's no judgment here with music therapy, and they just get the overall feeling and comfort that they need.
Hello again, and thank you, Lexi, for talking about the benefits of music as a form of therapy. Now I'm going to go into discussing the use of dance and movement as therapy for individuals with eating disorders. These disorders are a disconnect between the mind and the body. The mind sees a body that it is uncomfortable with and that it wants to change. It doesn't like what it sees. Even though they might be perfectly healthy looking or not healthy looking at all. This thought process leads to all of these self-harming actions like restriction and binge eating. Using motion and dance, these patients can begin to see themselves through a more positive perspective. Instead of looking at their body with scrutiny, they'll instead seek to better themselves by honing their dancing techniques. And using their body to create something beautiful. This can build confidence. Creating art through expression such as dance can be powerful. Dancing can reconnect positive emotions and sensations that the patient might not have typically associated with their physical self. They can start to see their body as a different kind of self-expression. They can say so much without saying anything at all. Dance and movement, when done alongside psychotherapy, can greatly reduce symptoms caused by eating disorders. The combination of these two things focuses on body image, which, as previously mentioned, is a huge factor in any person's relationship with their disorder. Next, Jenny will discuss the use of creative arts as a means to help people with eating disorders.
Okay, next I want to talk about the creative arts and how those play an impact in the treatment of eating disorders. So Bella already explained kind of what creative arts are, but I'm going to touch back again that creation is what these are focused on rather than the outcomes. So the therapy is actually in creating the artwork, whether that be the painting or the sculpture or the dance, rather than like the end result. It's what happens during the process. So the effects of the creative arts is that research has found is that it helps with processing difficult situations. It provides more of an outlet for people going through difficult times, that they're able to use these different methods to kind of process their overall emotions of it. It also has found that it has an increase in overall self-awareness, as many of these different art-based therapies do, and an increase in self-worth, like being able to create these beautiful pieces, or whether they're beautiful or not, just being able to create something and do something helps create that self-awareness and self-worth. Another big thing to touch on is that these creative arts have been found to help decrease anxiety and depression, which are very often found with patients with eating disorders. They usually struggle with these things too. So the creative arts are definitely something to look into in terms of using in the treatment of eating disorders for all of these different reasons. And they've been found to touch on things that need to be treated with eating disorders, such as the increase in self-worth and self-awareness.
Okay, I'm going to go ahead and share my screen. Okay, wonderful. So my name is Emma Andrus, and I will be going over the results of our study. So first and foremost, what is the importance of expressive art therapy? Well, we decided that the importance of it was that there was a noticeable symptom decrease. Some of these symptom changes included a boosting mood, boosting of confidence, a boosting of trust and energy levels. We also noticed that it can influence healthy communication as well as coping skills. Another reason why therapeutic use of art is important is that it allows those suffering from eating disorders to become more self-aware and self-expressive. This meaning that they find their interests, they're able to better find themselves and understand their talents, whether that be acting or singing or painting and drawing. This really allows them to find themselves. And lastly, another important aspect of expressive art therapy is that it builds trust. This being rapport with their therapist, or just a better connection with the people that want a better life for them and improvements. This can be done through expressive art therapy. And then also, what are the research outcome conclusions that we came about? We came to conclusion that all of our outcomes were non-measurable, that they were qualitative rather than quantitative, meaning there were no numbers involved. It was strictly opinion-based. Therefore, more research needs to be done. So our results continued. We thought it'd be important to share some of the studies that we've included. one of them being Padfield. Padfield's study included in patients with eating disorders. The intervention was writing groups, and the theoretical foundation was self-expression, well-being, and treatment. Measures were observed how writing, such as poetry, journaling, blogging, could be beneficial to individuals with eating disorders. The summary of this study showed how writing can benefit these individuals by allowing them to write out their thoughts, using writing as a way to process being able to share writing with a group and finding a common ground with those individuals within the group who are suffering from similar struggles. Another study that we would like to mention was Keel's study in 2018. This subject were individuals with an eating disorder. The intervention was psychological treatments. The theoretical foundation was decreasing negative symptoms. Measures were observed how negative symptoms could be decreased from psychological treatment. The summary explained how psychological treatment aspects benefits individuals by figuring out what is going on inside an individual's mind. This allows for people to process what is happening mentally and physically. So why did we choose these studies? Well, all of them incorporate some type of creative process, as well that all of them are within no greater than 16 years old. I think the oldest one we had was from Hints in 2006. Okay, and lastly, some discussion points that we'd like to bring up. The commonalities between our articles included a lot of self-expression being mentioned. This is because self-expression can be seen through many different types of arts, whether that be dance movement therapy, the music therapy, acting, all of those. Another commonality was nonverbal communication. This is very important because sometimes those with eating disorders or struggling from eating disorders have a hard time communicating their emotions, and expressive art is a way for those who have a hard time communicating emotions to non-verbally express this to those who are trying to understand. This makes it easier for therapists to give a better grasp on what they're really going through. So overall, as a group, we decided that expressive art therapy can increase quality of life, and it also doesn't have to only treat those with eating disorders, can treat many individuals across the board. It also can stimulate psychological growth and support the healing process, and definitely influence healthy communication and healthy coping skills. And that's all we have. Thank you. And these are our references.